see we're having a famous guest today, Bennett Napier, and y'all know him. Without further ado, y'all know what he's about. Let's get this show going.
Okay. All right, good morning. All right, let's try it again. Good morning. All right, Ricky woke you up, and I'm going to try to keep you awake before you have the after lunch siesta. So, all right, so this is a really good segue for what Ricky covered this morning, those of you that were in here. And just first and foremost, want to thank the DLAT for having me here and being able to kind of share some high-level information with you. A couple of things just in terms of kind of comparatives between myself and Ricky in terms of the content. I'll have some data too, so we're going to just overload you with data this morning, but it's all about helping you make informed decisions. And you will see presentation style. Ricky is much funnier than me, and those people that know us, she's actually probably pretty smarter than me too. So that's beside the point. So, all right. Let's see. Am I going to sleep? There we go. All right. So this is what we're going to cover. We're going to do this in about an hour, but as we go through, if you have questions on key areas, let's take them up while we get to them. We're not going to go too deep into any one of these key categories, but it's more just to kind of give you an overview, which is what the board asked me to do, and happy to do it. So laboratory market demographics, Ricky covered a lot on the clinical side. I will do a few clinical slides, but nothing repetitive, but just more to on the educational aspects and things of that nature. FDA activities, so we'll have a little bit of regulatory standards reference, and then we'll close with a few things, not per se commercials, but just more informational on what NADL has been doing and still doing relative to COVID-19 and some of the activities there. I'll definitely want to talk about our Foundation for Dental Laboratory Technology and one or two highlights on NBC. Just want to make sure those of you that know, Jeff Davis is a master CDT here in San Antonio, and then Cade, most of you know, is running the puppet master on the AV and everything above with the LAT. So both Jeff and Cade are CDT representatives on our NBC board. So Texas has 2 of the 9 NBC trustees on the board currently, so they've been doing a great job with us on that. So this just gives you some perspective and kind of ties in pretty well with what Ricky was talking about. This is from a lot of the things I'll reference what the source was. Sometimes it's from NADL, sometimes other organizations. But this is effectively your peers across the country, kind of what's keeping them up at night and what they're focused on. And this is, pre and post-COVID, if you will. Not much has materially changed other than obviously the springtime that we all know what we were all focused on. But as we kind of come to the other side, hopefully getting close to it anyway, technology is still the king in terms of where people are focused. Offshore, obviously both Ricky and myself have been at this meeting a lot over the years. Offshore was obviously, at the top of the list at some points in time. Not so much anymore. It's still out there, but it's not the number one issue. Aging population continues to be in the mix. But if you look at the dental data and the dental laboratory market data, in terms of retirement age, there's not a lot of material difference between when technicians are retiring, lab owners retiring, and their dentist clients. It's kind of everybody's working a little bit longer than maybe they anticipated, but most people are working, pretty close to the same time frame. Legislation and regulations, which is both state and federal, and certainly Texas is, one of the longest standing regulatory standards in the country, and it's always been a very, good model for the rest of the country. So this is demographics. So NADL we try to make sure we put this out there as much as we can, and I'll make some highlights as it relates to COVID and kind of the COVID-19 impact. So this, we go through at NADL, the Bureau of Labor Statistics. So I always preface this. So if you Google, dental laboratory market demographics, or you go on the Department of Labor website, 9 times out of 10 in your Google search, you're going to get effectively an occupational handbook snapshot of the market. And quite frankly, it's usually always out of date, and it's usually understated because even though it's the same agency, there's a different branch of the Department of Labor that we go to and actually pull the actual raw data. It's updated quarterly, and so we want to make sure we've got the best data possible. So a couple of things here I'll mention. Our first category is number of technicians, and this is all in. And so what I will show you is this is through September 2020. So the year-end data for 2020 will come out probably around June 1st or a little before. So much like dentistry, Ricky talked about furloughs and layoffs with clinical staff. So at the bottom, effectively early April of 2020, we in 2019 we're just under 46,000 technicians employed in the market. In April 2020, which was like that first week of April, we hit 25,000. So that tells you the impact on our marketplace of layoffs and furloughs and things of that nature. The good news is, and I don't have it here because I wanted to give you the latest data, in June, so by June, we were back to 35,000. So fairly, that wasn't fun at the time, but it was a pretty quick turn. And then September, where we're back a little bit over 40,000. So hopefully, we'll at least be level of where we finished 19, or somewhere close to that. So that's all things considered, that's not bad. Now, if we look at number of labs in terms of the second column, and again, we always segment labs with a payroll, so this doesn't include one-person laboratories, although it's a fairly small number now. At one time, it was a pretty big number. So most consolidation over the last 15, 20 years has been for small, one-person labs, either that they've retired or been acquired or merged in with a bigger lab. So really, all things considered, again, not a lot of drop, although I expect or predict that the year-end data will see a much bigger drop in the number of labs just based on what's occurred and stuff like that. Yes, Ricky?
I hate to say this,
yes.
I have lies.
Yeah, sorry. Yep, okay. So 2020, September 2020 for technicians was 40,124. And then labs with a payroll through September 2020, 5,521. And so we've continually, if you look in the chronology here, we're been averaging about 3% decline in terms of number of commercial labs. Doesn't mean everybody disappeared. It just means in many cases they got acquired, and so a smaller lab gets acquired, and then they merge in with another lab, that kind of thing. So it's not all just people lock the doors and decided to close up. A lot of times they're just going in with somebody else. And then, how many of you are owners in the audience? Okay. No. All right. How many of you are at least department managers? Okay. All right. So the wages, and you'll see this later too, wages actually, even in spite of COVID, and our profession's clearly in a supply and demand issue, to Ricky's point earlier, that the value of your knowledge is a big deal and continues to be that way, and will be that way for the next probably 8 to 10 years at least. So if you look at the wages, even with COVID impact, average wages went up, actually increased from 2019. So, and like I said, we'll publish around June the year-end data, and that will give you some good perspective. If you want it, like Ricky did, I didn't put it in here, but we can send to the board, share with you, because Department of Labor breaks it down by state, and so it'll show you commercial labs by state. Same chronology, we can pull that for you if DLAT wants to put it on the website. Wages, number of labs, and then technicians as well, so we can pull that for you if you need it. So let me just kind of transition on a couple of things here. Like I said, I'm going to cover quite a bit of data. And so NADL has been partnering with Valmont Research. It's a third-party research firm, and I'll talk a little bit about some of the things we're going to do differently this year. But we do a benchmarking survey on kind of just cost of doing business, and then we do a materials and equipment survey, generally speaking, each year. Last few years, we've done a 3D printing survey as well, and then we've done some exit planning surveys. But this, from most of you are owners in the audience, so this gives you kind of a timeline, if you will, of technology and what it's meant to our market in terms of what people are doing or in terms of traditionally performing roles. So least experienced, so EXP stands for least experienced technician in your lab. Primary job function, this is not segmented by small, medium, or large labs, so this is across the board, from a national standpoint, just a benchmark. So you can see 3 years running, and so the 2020 data actually, we already had the survey basically out in the marketplace, so this data was published in April 2020. So anything that's COVID-19 impact obviously kind of happened right after that, but so this was all based on where did people end up the fiscal year 2019, but the data was published in April 2020. So you can see ceramist, Granite Bridge, again, this is least experienced, but you can see the CAD/CAM, obviously is increasing, just probably more on the design side, and see where that goes. This is, as it relates to kind of like the recruitment, if you will, into the marketplace. This is where you see where folks coming in as an entry-level wage. I mean, it's not to say that it's not still out there, but I know Ricky and I started working together on NADL 20 years ago. That was our biggest issue, and still is a big issue with a lot of the schools of like, I've got to recruit a student into my program and say, well, I'm going to get out 2 years later and I'm going to make $8 an hour or whatever it might be. That is changing to some extent. And so you can see in terms of their annual salary for least experienced technician, kind of where that falls in terms of percentages. And you can see clearly the last couple of years there's been a transition in that context. Primary job function. So this is again for most experienced technicians. So obviously your more seasoned folks, and in the context of how we define seasoned, could be 5 years, which is the CDT eligibility requirement, or in many cases 10 to 15 years probably, and a lot of folks stay in this market for a long time, which is a great thing. So you can see you've seen the transition from ceramics, and then you see denture technicians, removables, and then you see obviously just on the management side, you continue to see increases in small increments, but CAD/CAM and folks in that nature. So again, it just gives you a snapshot of where things are. And the next slide's probably going to, I would think, shock some of you, but this is on the, again, most experienced technician. And again, regardless of how that they're earning their compensation, whether it's based on production pay or just a straight salary and some type of performance incentives and those types of things, that you can see a good percentage of people in the market, again, for their most seasoned technicians, are well over the six-figure mark. And so it hasn't really changed much. And so, I think the reality is, your sales representatives that go out in the field and talk to labs and meet with labs about materials and technology purposes could probably, confirm this, is it really does come to Ricky's point this morning, and it comes down to knowledge. I've got the technology, but don't know how to use it and don't know the science behind it. And if the person knows the science or can learn it, they're a hot item in the marketplace. And so you can see, again, I think you always look at the bright side. So the bright side is even with consolidation, which that's naturally occurring no matter what we do, that can people make a good living in this field? The answer is clearly yes, and it's only getting better. Now, does it mean there will be less technicians in the market? Maybe, maybe not. But the people who are in the market delivering, services and value to the clinical profession can make a good living. Whether this is, from a business owner standpoint and or a working technician standpoint, or a little bit of both. So I think that's a good thing. Now, Ricky talked a lot about, how do you price your units, and we'll talk about that too. Then obviously labor, if your labor costs are going up, then you have to really understand and know your numbers better, or at some point you're going to hit a wall, and sometimes faster than maybe you wanted. So just again, since most of you are owners, just these are benefits, and again, if you're trying to ensure that you can recruit and retain qualified folks to help you deliver and meet your mission, this is traditionally what you're seeing laboratories offer in terms of just general benefits. Probably not a surprise here in terms of which ones are most important. And we'll talk about insurance kind of at the end as kind of one of the NADL programs. This is also on the health insurance side, and I'm going to talk about health insurance at the end. But this is, you can see most labs, in some respect, do provide some type of health insurance or some type of copay. What I can share with you just on this market research is when we publish the surveys, and they go out to about 6,500 email addresses every time we do a survey, we get between 600 to 900 responses depending on when it's launched and what's going on. But what I can share with you is the respondents that participate in these surveys, they get the data complimentary. So they get executive summaries complimentary, and it's broken down by small, medium, and large lab. So it gives you even a further breakdown. What we're doing differently on our market research surveys in 2021 is we're really not changing the nature of the surveys that we conduct. We're just breaking it up into 4 quarters. Our surveys can be pretty lengthy, especially on the financial benchmarking one. So we're just breaking them up into more kind of what I call bite-sized chunks. And so the value of that is you're going to get data quicker. So every quarter you're going to have a survey and then data coming behind it. And then we're expanding kind of what I call the crosstabs, if you will, where you'll have more regionalization and state-specific data to say, okay, I want to know more about my region as opposed to just nationally. And so you'll see some additional data sets coming in terms of the analysis to, again, help people make informed decisions. And like Ricky said, you know, don't follow what your competitor down the street's doing. You've got your own business model, you've got your own cost, you've got your own niche of who you're trying to serve. But data can help you make somewhat more informed decisions in terms of, you know, what is the benchmark, and if you don't know what the target is, this at least gives you something to work from, and then kind of determine what your costs are accordingly. You know, just a kind of a segue, because I didn't do this at the beginning. So, you know, both Ricky and I kind of came into this field like most people, just kind of fell into it. So Ricky went from the lab side to the clinical side, and so I kind of came from a different direction. So in 1994, I started out as in dentistry as the executive director of the Florida Dental Hygiene Association. So yes, I was the only male in the room for every board meeting and pretty much every annual conference, although I think we had like six guys in the membership. You know, that was my segue, and then I went to the lab side. So still on the Jedi side, if you will. So average selling prices. So this is, again, from our spring survey. And this, again, is not segmented by small, medium, and large labs. The data that we publish does include that, but for today's purposes, this is just broad-based in nature. And so our goal is when labs provide this information, obviously, you know, that they've taken upon themselves to determine what their costs actually are and then price accordingly, whatever that may be in terms of what their goals and objectives are. So this gives you, just on zirconia-based crowns, kind of, again, as you make decisions for your business, and each of you should make independent decisions because you each are trying to do different things, this gives you at least a frame of reference beyond what you might see in some of the magazines, and we all see the same ads in different magazines that say, well, I could get it for this or that, and those things are out there. But what are the majority of people are doing in terms of pricing? So you've got, again, maxillary dentures, again, removables and implants have been continually to be kind of growing segments where you can see increasing average selling price. Crown and bridge, not as much, clearly more price pressure in that marketplace, as we all know. So removables is growing in terms of, especially if you look at that 400 plus, you can kind of see that creeping up. So that's a trend you want to pay attention to for obvious reasons. Then you see the flexibles where they are in terms of partials. And then just in terms of outsourcing, you know, you've got obviously exhibitors downstairs. You know, you don't have to do everything in-house. Some of you may choose to do that and be able to make that work. Some of you may say, we're really, really good at this, and this it just costs too much time and money to do these other things, and we can work with a strategic partner to help fulfill some of those things. So we continue to see, you know, whether it's a lab or a manufacturer or milling centers, those types of things, where people are looking to farm out, if you will, things that just don't make sense to do in-house and find strategic partners. And so you can see where that plays out in terms of partials clearly, as an example.
Would custom abutments be under other?
Yeah, we've got another one that's relative to implants. But yes, Gary, to your point, yes, implants is definitely a key area where people are doing that. And a lot of that relates back to FDA, which I'll talk about as well. This is a big piece here. I mean, it's going to be interesting to see how this plays out. So this is from November 2019. We did not do a technology survey in 2020. I mean, just from the timing standpoint, and again, obviously knowing what people were facing, a lot of people weren't making big technology investments during 2020. They might have, come into the year thinking they were going to do that, and then said, no, we got to have that cash for something else, like keeping the doors open. But it'll be interesting to see what happens the next few years in terms of how quickly this transition takes place as it relates to digital versus traditional. So you can kind of see where it was creeping up, and so this is interesting as well. Crown and Bridge sales by type. Kind of disclaimer, I mean, we do some work with the Identalloy Ident-Ceram Council, and actually Anton Wolf from Argonne, the CEO of Argonne, is the chair of the Identalloy Council. But so we, look at some of that data too, and you don't really see much material change in terms of the marketplace compared to what this shows. So you can see here just full contour zirconia. Again, probably not surprising to most of you, just based on what we see out there. But you can see in terms of where things are headed, and those companies that are continuing to, have a big piece of the puzzle on the alloy market, what that looks like. Okay. All right, so I'm going to talk a little bit about FDA. This is not an OSHA course. This is not an FDA course, but I think there's enough information that needs to be shared just to kind of wet your whistle. So a couple of things I'll mention before I go into the slides is, so NADL, we have a meeting, actually, again, like you're doing here, a live meeting in Nashville in a couple of weeks, and one of our courses at that meeting is effectively an interview with the Dental Devices branch with the FDA. They were going to be there in person, but FDA is still on a travel restriction, so effectively it's going to be a video feed of interaction between NADL staff and FDA Dental Devices staff. And so over the last few years, we have continued to maintain open communication with that agency, if nothing else, to be able to be aware of what's coming, and then help, in many cases, hopefully, kind of be proactive to ensure that we mitigate any encroachment in terms of our marketplace. So digital workflow has kind of changed the game. It's not saying it's a good or bad thing in the broad sense. I think most of us hopefully would agree it's a good thing. But in the regulatory constructs, it's changed how FDA looks at our marketplace. And so a couple of basic elements here to set the stage are those entities or establishments that are required to register, and I'll talk about who that would be in a minute. They have to pay an annual registration fee to the FDA. And you can see what that number is in terms of each year. I always kind of illustrate the difference between OSHA and FDA. If you look at how they are funded, if you will, Congress sets the budget for those two agencies as an appropriation, and then they determine as a regulatory agency, how do we generate revenue beyond congressional funding. OSHA makes a lot of its money basically going out and doing little friendly visits, but those friendly visits usually include some fines or citations. FDA, you don't really find that unless it's something really egregious. They come in, they evaluate what's going on and say, here are some corrective actions. But they're making their money on the front end as opposed to fining you. So through these registration fees, and especially on the manufacturer side, when manufacturers put something out in the marketplace that they're selling to you, whether it's materials or equipment or software is defined as a device in some respects, they go through additional processes called a 510K, which can be thousands of dollars to provide the background and the testing that company has gone through to say this is safe to be used in the marketplace. So for laboratories, one of the kind of the pillars for NADL is we continue to advocate to FDA that we want to maintain in the regulations that dental laboratories are exempt from registering with the agency. Primarily, the reason is, one, that's a big fee to pay every year. So that's one issue. The other issue is if you are doing some activity that requires you to be registered, your likelihood of getting visited or inspected is going to go up. You're going to have probably some corrective actions that you have to take place. And just to stay in compliance is going to require more time and labor just from a process standpoint. So we continue to advocate for that. FDA, I guess I'd say the public statement is they're not intending to repeal this exemption, and so we believe that to be the case. However, digital workflow has kind of muddied the water in terms of, are you a dental lab or are you a manufacturer? And so I've continued to use the analogy, if we looked back 50 years and said, well, in the 1950s, if we went down the street and said, here's 10 dental labs, and what are they doing and how are they doing it? Probably not a lot of material difference. On the analog, but when you bring digital into it and all the technology options that you have, that you can do things that you couldn't do 5 years ago, clearly, whether it was additive or whether it's CAD/CAM or printing. So there are scenarios that kind of can put you in a position where you might kind of come across the line, if you will, and we try to make sure that we're informing the market of what those lines are. And then as new scenarios get presented, we kind of write them off into chunks with FDA. So I'm going to take a couple of scenarios just as it relates to FDA. And so obviously 3D printing, so I mean, going back to what Ricky talked about this morning, CAD took, let's take a visualization that CAD took 20-25 years for full integration into the dental laboratory market. There were clearly early adopters, but for the majority of people, the users, it took a longer window to full integration. 3D printing is coming much faster, much faster. One, because you learned a lot from CAD/CAM. Two, printing, generally speaking, depending on what system you're using, is comparatively cheaper. It's not cheap, it's just cheaper. And so we find that a lot more labs are doing 3D printing, and clearly when digital dentures really take hold, then what does that look like? And so as one we wanted to show as it relates to printing is, printing of models, in and of itself, our argument to FDA, because there was one inspector that had tagged a dental laboratory and said, you're printing models, you need to register and you're not registered. Well, our argument back to FDA is like, a model is not a device, meaning, there's no patient outcome with the model. And so, they effectively, after a lot of deliberations on some conference calls with them, agreed with that. And so, long story short, if you're printing models, and quite frankly, most labs that have printers, that's 90% of what they're doing with printers in some cases. So we clearly didn't want to see all those users out there to say, well, now what? Do I just stop doing it or go ahead and register? And so we wanted to make sure that they didn't have to register in the first place. Then again, surgical guides, another key area here. So there's some very specific wording that we put in bold. And so what I would stress here is, if you're effectively printing surgical guides pursuant to an RX, that's the key element, pursuant to an RX, then you maintain, quote unquote, your registration exemption. And so that's, again, another key piece, because that's what a lot of labs are doing with the technology. In each of these areas, what we can share as kind of a best practice or general rule is all of you want to, hopefully, I think, grow your business in whatever respect, or you're replacing clients that are retiring out, whatever it may be, you're going to have new clients that you're taking on board, and you're trying to market what you do. Just be careful in terms of your wording of terminology that you use for your, display ads in clinical magazines or collateral material, especially your social media, Facebook or your websites. When you start to a couple of best practices I would consider is be careful of making a claim that your crown is better than the next lab, or saying that you're manufacturing something, because those are buzzwords to FDA. If you say, well, I'm saying I'm a manufacturer, and then they look at your website and say, well, you're not registered. We're going to come see you and see how you're manufacturing. So those are a couple of key buzzwords I'd just make a mention just as it relates to kind of mitigating any additional compliance activities that you might have with FDA. That's some general rules for you. This is, again, aligners. It's clearly another growing area. And so for most labs, the key here is, how are you going to do it? Are you going to do them in-house? Most labs are not. I mean, they're working with different partners out there to provide them as a product segment. But aligners are effectively looked at differently based on what they're intended to do. And so most of what dental labs make from a classification standpoint are either unclassified, meaning they don't have a product code, or if they do have a product code, they have, FDA's got basically a pecking order of class 1, 2, 3, 4. 4 really is not anything in dentistry, but their classifications are based on the risk of what happens if something goes wrong. So when we get into implants or sleep apnea, those types of things, then you go up the food chain in terms of classification. So aligners kind of are in the mix of that. So again, if you're looking to get into that, do your homework, do your due diligence of, okay, who can I do it with? Who's approved that I could partner with? Who's got their own FDA market approval for certain things? And then what does that mean to me if I'm going to fulfill that in that sense? So like I said, not doing too deep into any one topic here today, but more just to kind of give you an overview of some hot items that we're getting a lot of calls about. Okay, I won't go too much into the Health Policy Institute. Ricky gave some pretty good snapshots of that. What I can share is if you just Google Health Policy Institute, all their data is, well, I'd say all their data, but a lot of their data is public. Some of their data is password driven, meaning you have to be an ADEA member to dentist to log in and get it. But most of their good stuff, quite frankly, is public. And so, again, with our meeting in Nashville in a couple of weeks, we have the chief economist with the Health Policy Institute is going to be one of our speakers. And so we actually will film that, like you're doing some live stream here. We're going to film that, so it'll be on our NADL library. And so what we've asked him to do is less about COVID-19, because, hopefully we're on the other side of it. We'll talk a little bit about what that meant for the dentist, as you saw from Ricky's slides this morning, but more about what's the future look like. What does the DSO marketplace look like? What are the retirement trends that we're seeing on the clinical side? What are the technology trends that we're seeing? And then we're working with the Health Policy Institute. It's been, quite frankly, unfortunately, 2008 since they did their last big dental lab market survey to their members. And so we're working with them to hopefully launch that sometime this year, because that would be nice to have. What do the dentists think about our marketplace? Because it's been a while since they've asked very broad-based questions about the market. I will share a couple of slides from them. Just I didn't want to be redundant on Ricky's, but this one's a little different. Just again, what are the patients thinking? And so 90% of patients ready or have been back to the dentist. And so again, you can kind of see, and this is like Ricky's. This is kind of probably 3 weeks, maybe. They're doing about a 3-week lag time in terms of the snapshot. This one I like just from a general standpoint doesn't mean anything other than provide you data. But what if I'm a laboratory and I'm trying to determine what markets I'm going to expand to, I'm not saying it's the only criteria that you would make a decision on, but I'm probably not going to pick the state that the dentist has the average is very, very low compared to the national. Now, you may look at other factors and say, well, there aren't many labs in that state that I would be competing with, or whatever it may be. There's other criteria. But you can see, and there's a lot of variables that go into what this outcome is. What's the insurance marketplace look like? Is it fee for service or a lot of reimbursement issues? myriad of, what are the regulatory components in that state that drive this. So our buddy Sean Siegel in Alaska, he's fat and happy because they're at 246 is the average dentist up there in Alaska. North Carolina is an outlier there. And then you see California. California is clearly, just as it relates to labs and dentists, that state has the most labs and the most dentists. No surprise there. But they're not making a lot of money. So in a general sense compared to the other states. Texas is doing pretty well. You're close to the 200,000 mark. And so that's good to see there. Pacific Northwest, again, you can see, and just it's helpful to have this. I think, again, these are all reference points to say, what do I base my decision on? What criteria are important or are going to be based on your own business model? But you can do a lot with information, and it's hard to make decisions without some type of basis. The next couple of slides are from the American Dental Education Association. That's another group we partner with, just in terms of sharing information and continue to have dialogues with them. So you can see here, just as it relates to ownership for private practices, this is obviously driving the DSO, or one aspect of driving that is that you can continue to see the younger people they are as dentist practitioners that find less and less. And I mean, again, they're no different than we are. I mean, we all have talked, Marla enough, I don't know how, usually there's drinks involved, but that's a different story. But have talked a lot about over the years, we could have, 30 years ago, opened a dental lab for less than $10,000. Not today, but the clinician's in the same boat. And so the only difference between our market and theirs is then we add on their student debt. And so if we say the average student debt is $300,000, and I've got to go out and buy how much technology to run this machine, and the staff to do it, then that's pretty daunting if somebody's buying a house and getting married and then have kids, and now they're like saying, oh, I've got to work till I'm 100 now to pay all this off. So you can see why people on the younger clinician side are going, DSOs are attractive at least for part of their career. So again, from a marketing standpoint and just a demographic standpoint, you continue to see here, women. It's where the transition is in terms of what that looks like. What does that mean for you as your customer base? What are the hours that their practice is going to be open if they're a general solo practice? How many years are they going to practice? Those kind of things all go into the equation of like, who do you want to work with? And what are the things that will that impact you, potentially either positively or negatively. I will share this just, again, those of you that are data, geeks like me, all this data is on the ADEA website. It's ADEA, ADEA.org. You just look up ADEA snapshot. All of this is in graph form and PowerPoint downloads that you can use for maybe if you do lunch and learns with your clients, those kind of things. These are nice things to be able to offer your clients as a value add. You can see here just in terms of number of accredited programs, this is not the greatest news, but you can see the trajectory here at the bottom blue line is the number of graduates from dental laboratory technology programs on the accredited programs. So we lost another program in Oregon last year. We don't have one that I'm aware of that's on the docket that would be closed in the next 24 months that we're aware of. But what I can share is even though that trajectory has gone down some, we believe it's going to start to creep back up, even though there's less programs. We just had our educators conference virtually a few weeks ago. We've got a couple of programs in the country, like New York and Indiana and LSU and some others. They've got waiting lists for students, and so New York, for example, they're close to 100 students just in that one program. So there are some programs that are growing based on, again, what are they teaching, how are they teaching it, what technology are they using, and then what's the market value of that student coming out. A lot of the schools that have found a way to adapt, as Ricky was talking about this morning, they're providing a different value for the graduate coming out and to the people that are hiring them, that they can go to work and be proficient much faster based on what they're teaching. And so the good news is, most students that want to stay in this profession can get quickly placed and have multiple offers and look where they want to go. All right, so a couple of things here, and then I'm just going to open some kind of open forum. These are just some things, as it relates to COVID, but these are things we would do anyway as it relates to whatever the issue of the day is. NADL's goal is to be on top of it and help you kind of filter through the noise and determine, okay, what does this actually mean to me? So a lot of what we did back in the spring was, especially as it relates to what state people were in, I was like, are we an essential business or not? Can we stay open? What can we do, not do? Whether you had work or not coming in, that's a different issue, but the fact of the matter is, if you had a case that potentially would show up at the door, then you want to be able to fulfill that. And so we worked very closely helping people to do that and put a lot of our analysis on our NADL.org news page, and we continue to do that. Webinars, we were doing webinars at least once a week. I can tell you that in the peak of COVID, a typical webinar for us is 40 people. We had some last year that were 450 people on our webinars. Now, a lot of those were infection control related, PPE related, those kind of things, but the fact of the matter is people were like, okay, this is confusing, and it was, what does this stuff mean to us? So we did a lot of helping people with PPP processes and things like that. The more current activity that, just for relevance, is we had a ton of interaction with ADEA and a much broader level of staff than normal. We had a lot of interaction with their public affairs staff in DC, as Congress was doing different relief acts and how they applied to dentistry. The current activities clearly are related to the vaccine. So what we can share with you, because I go in every day and I still see people asking, where technicians classified in the scheme of vaccines. We have all that on our website. So in December, there were 18 organizations partnered with ADEA, and ADL was one of them, that said technicians need to be in the mix and defined as healthcare professionals, even though in some cases you're not doing direct patient care, you're still doing healthcare and you still have infection control issues clearly. So there's a lot of components that led to, okay, are you healthcare or not? And for this purpose, the answer was yes. So CDC in December put that out. Then we had some follow-up with the U.S. Surgeon General's office, which, I guess I'd say luckily, we'd never had to interact with the Surgeon General's office, but we did on this issue. They have a dental officer that's assigned, and so, some outcomes that came from that is kind of the telephone tree, if you will. We got with CDC, we got the Surgeon General's office, and then basically within about a week after that, then they sent out, the Surgeon General's office sent out memos to all the state dental boards and said, make sure as you roll out communication on who within dentistry is eligible for what vaccines in the time frame, that dental technicians are in the mix, because we've defined them as healthcare professionals as it relates to vaccine rollout. So in most states, so at least that was out of the way, but then you had to wait on the supply chain, if you will, for each state of the tiers. Each state had a different approach and still has a different approach, but the good news is we took at least one barrier out of the way very early on, so if people wanted to get it, they could get it. And I think a lot of states we've seen technicians be able to get it. As an aside, because obviously Texas is a regulated state, at the state level, if you ever have had trouble and haven't gotten it yet, or you're getting some pushback, can you take it or not? A lot of folks have been able to take their CDT cards, and that in and of itself has been your quote unquote identification to define you as a healthcare professional. Couple quick things here. Going back to the health insurance slide, meaning like what a typical lab's offering their employees as it relates to health insurance. So we just launched, actually like 2 weeks ago, an online portal with this company called Decisely. They are very focused on the healthcare market in terms of benefits programs. So on the NADL website, you can get to their platform. It's an online platform. You can upload your census data and get quotes on different types of health insurance programs, whether it's a HMO, a managed care type, or major medical, depending on what you want to offer. The other piece is a broader based with this company called Gallagher is the other categories of insurance. So everything else, including those of you that do like chairside service work, we encourage you as a best practice to have professional liability insurance. So all of the other aspects of insurance are with this company called Gallagher. CNA is the carrier, and NADL's got its own claims staff within CNA that will help with those types of things. But we encourage you, if nothing else, just to shop the portal through the NADL provider and see if there's either some cost benefits that you can get or some additional value adds on your coverages. Especially, insurance coverages were a big topic and still are, obviously, as it relates to COVID and things of that nature. So encourage you to maybe take a look at that. All right, a couple of things. Ricky gave me a shout out this morning, so I'm going to do one back. So this little logo on the right hand side exists because of Ricky. Ricky, one of those 2 a.m. things that she was talking about, she woke up and had this bright idea like, we need to have an educational foundation that can basically redistribute some funding back to the marketplace to help workforce training. So in 2008, this entity got launched. Oregon's one of our biggest supporters amongst some of the other exhibitors downstairs. I am giving them a shout out because they do a lot for the foundation. Sean Nowak is the fiscal officer for the foundation. He's downstairs at his booth. But this foundation effectively has grown, I think, to some extent, well beyond what we thought it would in terms of, at least in the time frame by which it did. And so this organization is all about education, whether that's bringing people into the field and helping them, or existing workforce, advance their and improve their skills. And schools are in the mix of that too. So in a normal year, even with COVID, I'll say this, couple things real quick on the foundation. Last year we gave over 65 scholarships out for people who wanted to become certified, up to $1,000 scholarships where they pay for all their study materials and their test. And then on the other side, people who maybe already had a CDT or just wanted to do advanced education, we've got partnerships with COIS and SPEAR and other entities. And so in that respect, on those, we've got a Mark Jackson Memorial Grant. So on those, we gave over like $40,000 worth of grants last year to technicians to go through advanced education. And so, I encourage you to look at this for you and or your employees. The other thing I just mentioned as it relates to COVID impact, two things. We have a Cdt Hardship Grant. So if a lab employer maybe traditionally used to pay for their technicians' renewal for their CDT, there's a hardship grant, that would pay and cover your CDT renewal for a year. And then for those of you that are on the owner side, COVID taught us a lot, some things we didn't want to know. But as it relates to an employer standpoint and OSHA and safety practices, there is an element of OSHA where you can actually have OSHA come in, not as an inspector, but as basically an auditor, if you will, to kind of help you analyze your processes and determine what you can do differently. And they're not inspectors in the sense that they're going to fine you after that, meaning like you're voluntarily calling them in. And so we've got a grant related to that to help you take any action based on the corrective actions that they might outline for you. There's an OSHA safety grant that launched recently on that. The CDT piece, I'll just quick mention here, and then we'll get into Q&A. We continue to kind of publish information. The CDT, trends are holding their own. The good news for NBC in some respects is we had already transitioned to gone effectively, aside from maybe certain accommodations, the written tests were already 24/7 computer-based prior to COVID. And then on the practical side, we had just basically launched, and then now we're full-scale launched. The practical exams now can be done in your own lab. There's basically a remote proctor process that we have where people can do their exams. It's just like the written test. You've got camera running, and then people ship in their work. And rather than examiners coming to a host facility, our examiners basically analyze work when it comes back in. And the process is the same from the evaluation standpoint. Only difference now is you're not having to get on a plane in some cases to go take a practical and use somebody else's equipment and things of that nature. Testing is already, and it creates anxiety. And so if you're in your own environment, in your own setting, that helps things. So we've seen our testing numbers, especially in the last really 90 days, go up significantly because now we've had a lot of beta testing back in the summer, and to see how that played out, and people are really enjoying it, to be frank with you. So we encourage you that, consider that. So when then the time allotted, let's see if there's any questions, any kind of open forum. If there's any topic I didn't hit on that you have questions about, what happening out there. If I have a definitive answer, I'll tell it. If I say I got to research it and get back to you, I can do that too. But wherever you'd like to go, it's kind of open forum. All right. I think you want a lunch break. So I will be. I have a booth downstairs, so I'll be there most of the afternoon. If you don't see me at the booth, I'm probably in the hall somewhere. So if I miss you, just come back, and then obviously I'll be there tomorrow. I just want to again thank DLAT for having me here, and just our partnership working with you. I mean, this is obviously a regulated state, ton of CDTs in Texas, so we just greatly value what you bring to the table, and appreciate very much your time this morning. So thank you.